I'd like to call the Health Committee meeting to order for the month of August. Welcome everybody to the PAL room. Under previous business, can I get a motion to approve the previous meeting minutes? Motion by Mr. Destin, second by Ms. Willingham. All in favor?
Aye.
Any opposed? Under previous business, number 2, authorizing an agreement with the Addictions Care Center of Albany Incorporated and amending the 2021 Department of Mental Health budget. Dr. Giordano, welcome.
Thank you, Mr. Chairman. With regard to number 2, respectfully ask that it be tabled. This is a grant from the state, and the state has still not cleared us to make this award to the agency. I was hoping that it would be ready, but it's not, so if we could table it and not withdraw it.
Okay. Table okay. We need a motion, okay. Okay, a motion to table by Mr. Ward, second by Mr. Destin, all in favor?
Aye.
Any opposed? Thank you.
Thank you very much.
New current business, authorizing the renewal of a contract for reentry services with the New York State Division of Criminal Justice Services.
Yes, sir. So this is, many of you have heard me talk about this program before. This is a program funded by the Division of Criminal Justice. It's been housed in the Mental Health Department for the last 10 years. It's designed to help returning citizens to Albany County from state prison. And it is in the amount of $220,705, and it is a contract renewal.
Okay.
How much did you say?
220,000.
Oh, 220.
That's through, I think, September 2022.
Yes, sir.
Okay. Any questions from the committee?
Sure,
Wanda?
yes.
I wonder.
And so, and just, Dr. Giordano, just repeat what the funds are for.
Yes, so they're actually split into 2. We get $220,000, give or take, from the state. We have a coordinator of the program as a county employee at about $60,000 plus fringe, and then we subcontract out the case management to a not-for-profit in the community.
So you said 60,000 is for the coordinator,
Yes.
and the rest is used for?
Well, it's at $60,000 and it's fringe, so we keep about $95,000 inside the county, and then $125,000 goes to the case management agency that actually works with the returning citizens.
And how many participants do we generally get?
Yeah, so every year except last year, we were approaching 250 that we worked with.
In the reentry program?
Yes, yes. This last year, we were hovering about at 100, and it was almost entirely due to the prisons, the releasing into the COVID world, and everything was just very reduced.
So are the people still coming from Hudson, or are they coming from someplace else?
No, I remember you asked me that once before. They changed that funnel, so we get referrals from all the prisons.
Can I just ask you to do one thing for me?
Of course.
I really, in the meeting, can the people who are speaking, can they pull the mask down? Because I can't understand it. That's just a question.
Oh, yeah, I think the guidance is you have to wear them unless you're at your work spot and you're speaking, I believe, but
Well, I can't understand it. That's
Okay.
why I'm just asking.
Yeah, I'm sorry. I'll repeat myself as many times as you like.
Okay, speak louder then.
Yes, so rephrase the question, please. Oh, about the one prison?
You can speak up.
Yeah, I'm sorry.
Okay, so it wasn't Hudson. They're coming from,
All over.
oh, they're coming from all over.
Yes.
And the numbers that people re-entering into the capital district or Albany County, is that what is the court of?
Yes,
Okay.
yes.
Okay.
These are all people who reside in the county. So last year, there was about 100, but in previous years, there were upwards of 250 each year.
So when you say 100, that's 100 people coming back, being released,
Paroled.
paroled, 100. And I know there used to, the information used to be available by zip code. I know you don't have it tonight, but.
Oh, yeah, we can get that for you.
Okay, I appreciate that.
Sure.
Okay. Have you seen an increase in numbers since, no?
In COVID, they were really suppressed. They were just releasing fewer people.
Is it because they're releasing less people?
The referrals come to us through docs and DCJS, and the numbers were just lower.
Thank you.
You're welcome.
Motion if there's no more.
Any other questions from the committee? Now we have a motion from Ms. Willingham, second by Mr. Ward. All in favor?
Aye.
Any opposed? Excuse me. Number 4, amending the 2021 Department of Mental Health Budget Administrative Adjustments.
Yes, sir. So we're requesting to move $35,000 from a vacant position into our overtime budget, which we have determined at this point in the year, if we don't do anything, will be about 23% overspent. And this is largely due to the increased work that we're doing at the jail, where we had to, we don't get a choice, we have to fill the need. And our mobile crisis team, where we also don't have a choice, we have a number of running vacancies in that program, and we've needed other staff to come in to do overtime essentially to fill the need. So we believe that this transfer will get us to the end of the year, and we also believe that we'll fill those positions hopefully as soon as possible. But there aren't a lot of social workers out there right now.
Sure. Any questions from the committee?
How many staff?
Where?
At the jail, Wanda, or?
Okay, you can start with the jail, I'll be fine with that.
Well, at the jail, we have 6 social workers, no vacancies. But over the course of this last year, the staffing fluctuated, the need increased, and we had to use overtime at the jail. At the mobile crisis team, we have 10 staff and 3 vacancies, and all those shifts have to be covered. So we've brought in other supporting staff to fill the shifts, and we've had to pay them overtime.
How many positions was that? At
Where?
the mobile crisis?
At the mobile crisis team, if we're fully staffed, we would have 10.
10.
We have 7 now.
7, okay.
With increased workload.
Well, it's also, with some of our programs, we could back off a little bit and say, well, we don't have the staff, so we can't work at 100%. In an emergency service like mobile crisis, we have to work at 100%, whether we have the staff or not. So we have to bring in people to fill the...
Any other questions from the committee? Hearing none, can I get a motion to approve?
I'll make that motion.
Motion by Mr. Ward. Can I get a second?
Second.
Second. All in favor?
Aye.
Any opposed?
Thank you, Mr. Chair. Thank you.
Thank you, Dr. Giordano.
Thank you, John.
Thank you. Good night.
Good night.
Good evening, everybody.
Good evening.
Good evening, Dr. Whalen and Witherspoon. How are you tonight?
We're good, thank you.
Moving to the Department of Health, we have number 5, authorizing an agreement with the Schenectady County Community College regarding a community health worker intern program.
So this is just to enter into an agreement to facilitate an educational opportunity through Schenectady County Community College. They train community health workers who work in various programs and services, and also with community-based organizations around the area to improve the health of county residents. We're strong believers in the model and happy to participate with them in this program.
This is 5 years, I think. Any questions from the committee?
Can you, so it says just entering into a 5-year agreement. So, is this a 2-year program? I'm asking a question now.
I am not sure if it's a 2-year or 1-year program. I can find out about that.
Program itself, is it,
I'm not sure either.
like, is it a 2-year?
Can you,
Associates or something?
how about,
I think that's-
can you tell me when? Do you have an idea when it's supposed to start, or,
So if this,
this is from,
if this goes through, then we would start accepting interns from the spring
2022.
2022.
Yep.
okay, I'm gonna be very honest with you, I didn't understand a word you said, and it doesn't have anything to do with you.
Okay, well, that's
It's
okay,
me.
it's both of us speaking. So Shanna was just saying that if this goes through, we will start to accept interns in the spring of 2022 and provide them with a good public health background.
And so what would be the name of the program if they're going, would they come out with some kind of certificate, or?
I think they do come out with a certificate that enables them to be a community health worker. You know, there are a lot of new programs that are being developed around this workforce. The workforce is, you know, it has the mission of training people that don't necessarily have a high level of education, but are trusted voices within the communities they serve. So we seek to give them an experience within the local county health department, the same experience of many of our community health workers. So they go out and do a lot of health education. They visit people at home. They help them address needs related to the social determinants of health. So they would provide them not only with health information, but link them to other programs and services throughout the county. And having this kind of experience is very helpful for them when they go out into the workforce.
So there must be some kind of, is the syllabus prepared or no?
The syllabus is prepared.
Yes.
And this is our renewal. We had this partnership with Schenectady before, and we did actually end up hiring one of the interns that came through this program.
Okay, I'm just interested in this because we're trying to get a little bit more information out to the constituency to let them know. So that, since this starts spring of 2022, our high school students, I guess, they don't-
I think they would probably be able to go into the program at Schenectady County Community College. It's probably a high school diploma.
Okay. If we could just get that much information.
Yes,
so that
Definitely.
happy to
we
get you
know
more
how they would
information
do
on
it.
the program, because I agree, it's important.
Thank you so much.
Mhm.
Thank you, Wanda. Any other questions from the committee? Hearing none, can I get a motion to approve? Motion by Mr. Touche, second by Mr. Tunney. All in favor?
Aye.
Any opposed? Thank you. Number 6, amending resolution number 365 for 2015 as amended by resolution number 172 for 2020 regarding the childhood lead poisoning primary prevention program.
So this is a long-standing grant that we have through the state, and this is funding that we utilize to promote inspections in high-risk neighborhoods of houses that may have lead paint. And the zip codes are 12202, 06, 08, 09, and 12210. Although if we are asked, we usually provide the services to other Albany County homes as well. And where we find hazards, then we meet with the owner and provide, or the landlord, and provide education and provide remediation so that there aren't risks to, particularly to young children who are living in those environments.
I know we talked about this in the past. How are those zip codes determined? Is it based on previous cases, or is it based on age of homes? I mean, I don't know what factors drive that zip code determinant.
So I think there's two factors here. I think there are the prevalence of neighborhoods that have, most of the neighborhoods in Albany City have high incidence of lead paint. Any house that's built before 1976 usually will have some lead paint. So it is that, and it is, I believe it's also identified based on cases that they have identified. These high needs neighborhoods are kind of a theme through a lot of our grants. So it's, we try to target the services primarily to where they're most needed. But, you know, we do provide these services outside those areas as well.
Sure. Mrs. Birmingham?
I live in North Albany.
Mhm.
Okay, and it's bothersome to me that at one 12204 is left out a lot of times. And even during the pandemic, when they were doing the vaccine, it was not included, okay? And I know that when you should be done by census tract instead of whatever broad level it is, because that means that we're being pulled into Manans,
Right,
okay?
yep,
And so I'm just concerned that I keep seeing this over and over again. I'm going to continue to bring it up to try to do something about this 12204 being excluded.
okay,
And also because the number of houses that are out there right now that have red X's on them,
yeah,
okay? And having done a lot of going from door to door there, I know that those houses have problems with lead paint. I had a son who had lead poisoning.
is that right?
So this is something that is like really, and he could never learn how to read, okay? And so for me, this is something that is very personal,
Okay,
okay? So I really would like to see something, done about that, okay?
I absolutely appreciate what you're saying, and there's a couple of things that we don't create the zip codes, it's based from the state. But what I will say is, we pay attention to the community as we know the community. So if we get calls in from other neighborhoods, we don't exclude services just because this is what this is supposed to be focused on. So if somebody called us and said, I live in 12204, can you come and check my house? We would say yes.
Okay, so I guess having experienced this, I don't know that there's a problem, okay?
Mm-hmm.
Or even until it already exists, okay? And so sometimes it may not be caught, all right? So that's another reason why it's an issue, okay? And I just don't think, I think that there's something else a little bit more proactive. And again, the zip code is mainly majority minority, okay? But also too, like I said, I've been to a lot of those houses. I know what they look like, okay? And so I would like to pursue that North Albany be added to this list and not wait until somebody shows up as far as a number is concerned. Because by then they could have moved someplace else and already have been affected by the lead poisoning.
Thank you.
Just for clarification, it's the New York State Department of Health that determines uses the zip code as a classifier? Because I
Yes.
know Wanda has expressed this, like she said, with the vaccines, and as you know, you live in the city of Albany yourself, and so do you, Shauna. These zip codes are like fingers. You are 12203, which goes, you live in probably one of the older homes in Albany, but it goes all the way out to the Dunes, which happen to be 1970s, and the population is all,
Right.
just like Wanda, her zip code includes Manans, which doesn't represent, North Albany, and it's a completely different animal. But Wanda, maybe we can, that Health Equity Task Force, we can create a letter to the New York State Department of Health saying maybe we can, let's not consider zip codes, but neighborhoods, but which the Albany County Department of Health is already doing. But any other questions from the committee? Hearing none, can I get a motion to move?
So moved.
Motion by Mr. Best and second by Mr. Tenney, all in favor?
Aye.
Excuse me. Number 7, amending resolution number 199 for 2016 regarding the lead poisoning prevention program grant.
So this is the other component of our lead focus, and this is the reactive component when a child is identified with a high lead level, and we go out to do the environmental assessment of the home and do the remediation and education with the family, and work with the care provider to make sure the child is appropriately treated.
Any questions from the committee? Can I get a motion to move?
I'll
By
make-
Mr. Best and second by Mr. Ward, all in favor?
Aye.
Approved. Number 8, authorizing an agreement with the New York State Department of Health, Health Research Incorporated regarding the Public Health Emergency Preparedness Program.
So this is a yearly grant that we get from New York State Department of Health and HRI for our BT Preparedness. Obviously, it's important to prepare for public health emergency response and continue training and recruitment of the MRC. So we know how important they've been to us this year. But this is the usual grant that we get for that.
Thank you. Any questions from the committee? Hearing none, can I get a motion to approve? A motion by Mr. Tenney, second by Mr. Ward. All in favor?
Aye.
Any opposed? Unanimous. Number 9, amending resolution number 378 for 2020 and amending the 2021 Department of Health budget.
So this is an additional grant funding that we received for COVID-19 response for the period of 7/1/20 to 3/31/2023. And this funding is going to be used to cover our overtime and also to increase staffing at the health department so that we can continue to provide rapid and complete case investigations and also support community vaccination efforts.
Any questions from the committee? Hearing none, can I get a motion to move? Motion by Mr. Beston, second by Mr. Touche. All in favor? Any opposed? Number 10, authorizing a submission of a grant application to the New York State Department of Health regarding the indoor radon grant program.
So this is a grant availability that we became aware of and decided to apply for it for the New York State Department of Health for remediation of indoor radon, which is a health risk for individuals. So we are requesting application for that, and then we'll have more information on what that will entail if we get it.
Thank you. Any questions from the committee? Hearing none, can I get a motion to move? Motion by Mr. Beston, second by Mr. Ward. All in favor?
Aye.
Any opposed? Unanimous. Number 11, authorizing an agreement with the New York State Department of Health. I'm sorry, I just did that one, didn't I? No, authorizing an agreement with the New York State Department of Health, Health Research Incorporated regarding the expanded partner services program.
So this grant is another longstanding grant that we have from the state, and it enables us to locate and track individuals with HIV who have lost access, who've fallen out of care for a period of time, to find them and make sure that they're getting appropriate care, educate them, and conduct services to ensure that HIV-infected individuals are appropriately treated and their disease is controlled, and hopefully stem the spread as well.
Any questions from the committee? Hearing none, can I get a motion to move? Motion by Mr. Touche, second by Mr. Beston. All in favor?
Aye.
Any opposed? Unanimous. Number 12, authorizing the submission of a grant application to the New York State Department of Health regarding the Perinatal and Infant Community Health Collaborative Initiative.
So this is a new iteration of a long-standing grant, which was our Mitch grant, which focuses on moms and babies. And we are implementing ongoing community-based strategies to improve the health and well-being of individuals from reproductive age and families, with a focus on individuals in the prenatal, postpartum, and interconception periods.
Any questions? Ms. Wellingham?
Yes. So could you tell me how you carry this out?
Sure. So we have nurses and we have community health workers that are out in the community and trying to identify women who may need education on how to have a safe and healthy pregnancy, try to loop them into care if they have not, because we know getting appropriate prenatal care has a significant effect on the health of both the mom and the baby. It is also, after the baby is born, we have nurses that go out to the home and go over care of the infant, weigh the infant, work with the pediatricians in the home, and we provide a lot of education as well in the community.
So does this work in concert with the early intervention program?
The ages are different. Early intervention is for children. I think that, and this is kind of women that are considering conceiving or are pregnant or are in the immediate postpartum period.
I thought I heard you say after they, afterwards.
Yep.
Okay, so I misheard what you said. So how do you get the information out?
So we work with hospitals, and we ask the hospitals to report to us high-risk pregnancies, and let them know when they have somebody that they would consider is appropriate to reach out to. We reach out and ask if we can come and visit in the home. If we can, we do. If not, we provide education over the phone and try to make sure that they have all the services that they need.
Is this new?
No.
Okay, so.
The name, they changed the name of the grant. That's what's new. But the service is essentially the same that we've been providing.
So how many women would you say that, we have service yearly
So,
or last year?
So last year is a bad year to ask because the staff was entirely preoccupied with COVID, and there was a period of time where that the services weren't up to normal. But in a normal year, we would provide about, from 2018 to 2019, there were 668 home visits.
When you say 650 home visits, does that count each and every time you go? Could be more than.
It could be more than one, yep. So that's not necessarily 668 discrete individuals.
Okay, and so how long do you follow them?
Usually,
On average?
yeah, usually we follow them as long as we can, up to about 12 weeks postpartum, to make sure mom and baby are doing well. And, we do handoffs. We work closely with children, youth, and families in situations where, there may be multiple children and there may be other issues. We work with all the other agencies in the county if those needs are addressed or identified.
Any other questions from the committee? Hearing none, can we get a motion to move? Got a motion, Mr. Beston, second by Ms. Willingham. All in favor?
Aye.
Any opposed? Unanimous. Number 13, amending the 2021 Department of Health budget, administrative adjustments. I believe these are collective bargaining step adjustments, maybe?
Right, it's just a bargaining step adjustment, so for one line, the senior public health aid by $400 for a step.
I'll make the motion.
Okay, motion by Mr. Ward, second by Mr. Touche. All in favor?
Aye.
Any opposed? Thank you. Can I get a motion to adjourn? Motion by Wanda. All in favor?
Aye.
Thank you, doctor, for everything you
Thank
do.
you very much.
Yes,
Witherspoon, you as well.
Have a good evening.